All right, friends, listen up. If you've ever wondered why anxiety, depression, or food addiction can cling to us even after we've done all the work, today's guest will blow your mind. Dr. Fredric Schiffer is a Harvard-trained psychiatrist and brain behind the dual brain psychology, a science-based back approach to suggesting each of us basically has two separate minds in our head, considering that half of us will battle with a major medical mental issue. And at some point, his research could be the game changer that we've all been waiting for. So, Dr. Frederick, I would just say hello to everybody because I'm thrilled to have you on the show today. I'm really excited. I love how you talk about the two minds and how you discuss how each part is separate. And I want to dive deep into how understanding the two minds can lift the weight off of a lifelong emotional pain that many suffer with. So, Dr. Frederick, in 1 minute, can you break us down into the dual brain psychology and tell us why it might, make some feel that struggles feel impossible to shake?
Sure, sure. So in one sentence, no. Uh,
All
uh,
right, I'll give you
uh,
two.
uh, so everybody knows we have a left brain and a right brain, and it turns out that if someone had brain cancer and had one of their hemispheres removed, they'd still be a human being, and if they might not be able to speak, but they could give hand signals, and you could interact with them, and they'd be a normal person with just one brain. And and what I've discovered is that in normal people, you can stimulate one hemisphere or the other through a very simple couple of very simple techniques, and you can talk with two people within one person, and one side in most people, or a lot of people, all the people that I see as a psychiatrist, have trauma that gets associated more with either the left brain or the right brain. And for a given person, it stays on that side. And we try to stimulate their healthy hemisphere and also have the two minds communicate in a constructive way rather than have them attack each other and try and sabotage each other. So it sounds strange, the man with two minds, and this has been a hard sell, but the truth is that uh, it, we really do have two different minds,
Right.
and then one of them, and I'm included in that. That sometimes I'll wake up at 3 in the morning and I'm feeling upset about something, and I go down and I talk to Freddie, and I'll use my hands or an envelope, and I'll block my eyes like this, and I can explain how it works, but I can simulate one personality or the other, and so I want to at that time talk with the troubled part of me and ask it, what are you upset about, and then I can it gives me an easier way to access what's bothering me, and then I can look out the other side, and it doesn't bother me. I'm looking at the same problem, but I can handle it, and uh, this is very common in my practice. All of my patients use this technique, and if somebody walked by and heard the conversation, they think we were crazy. It was talking to two people and one person, but it really is important, and it's a real phenomena that that on one side, a person can feel very depressed and anxious or have cravings, and on the other side, they feel more confident and healthier. And I try and get the two sides to cooperate, to get along, and to be. I want the healthy side to be a co-therapist with me, and and the aim of it is to help the troubled side by understanding its trauma. Everything is really caused by trauma, all of the pain and dysfunction.
There are times when, sometimes, you might be feeling fine and then something can trigger self-doubt. And then all of a sudden, your whole personality for the day, you start to feel different. Instead of feeling that confident, vigorous personality that you usually may shine with, all of a sudden, something triggered something and you feel self-doubt. And you start to, like, when you're working, you're not as confident, you're not performing as well.
Right.
How do we balance out our brain so we could actually overcome this and not drag along the entire day feeling this way?
Okay, well, first of all, you should read my book. It's called uh, um, Goodbye Anxiety, Depression, Addiction, and PTSD. Uh, and it's on Amazon, and you can get to it through my website at dualbrainpsychology.com. Uh, but if you don't have time to read a whole book, I can explain what the book is about. So uh, uh, if you're feeling that way and you have a meeting, and so you have to pull yourself together quickly,
Right.
then I would suggest getting a piece of junk mail like this and blocking your eyes. And what that does is it can activate your healthier mind, and then it kind of pulls it together. And instead of you're drifting into a more troubled state, it pulls you out, and it's really very effective. And I'll show you how to do that. The better answer is to get to know yourself and to look out the negative side, and like I do at 3 o'clock in the morning,
Mhm.
and and talk to it. Like anybody else, you can talk to yourself and ask it, uh, why are you upset? You seem distressed. What's going on? What's this remind you of? And 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 see if you can understand more what this distressed part of you is concerned about. That one of the things that I am sure of is that the troubled mind is a sensible person.
Right.
It's like a child, but it has reasons for what it's doing. And
Mhm.
often, usually with the trauma, it's like a child who misunderstands the world.
Yeah.
Maybe the child was told, "You're a loser and you'll never amount to anything." And that wasn't true. He was 3 years old.
Yeah.
A lot of men with that for some reason. Uh, and and then what happens is they go to school, and then because they lack confidence from what happened at home, they don't do well in school, and then the teacher yells at them, and uh, and so the trauma kind of rolls on itself, and they lose sight of that initial trauma. Forget they don't when they come to see me, they don't even know about it, and so you have to get in touch with that and try to help it to understand that you're not a loser, that you're a valuable person, that yeah, you were injured, and that's a whole different thing. That being a loser is like a diagnosis, and I hate diagnoses. I think they're destructive and inaccurate. And a bunch of psychiatrists sit around a room and they come up with a label and they find characteristics for it, and then that becomes a diagnosis, but it doesn't have any reality to it. We
Right.
could make a son of a bitch diagnosis and
Hmm.
say, well, what are the criteria? Well, they drink a lot of beer and they curse a lot, and they don't pay their debts. And if they fit the 4 criteria, they get the diagnosis. But it doesn't really lead to a real understanding of why somebody's misbehaving,
Yeah.
you have to get into the trauma and the negative mind.
Does now When you break up the brain into two parts, because there's
Yeah,
four parts of the brain, really, because you have the frontal lobe, you have the left and
you do, right. Uh,
right.
and and Jill Bolte Taylor has a book out about the four parts of the brain. I focus on two parts because the hemisphere has a front and a back and a middle, and it has 1,000 parts to it. But
Yeah.
the uh, it takes a hemisphere to have a conscious mind,
Hmm.
and so I think that there are non-conscious parts to the hemisphere, but ultimately I'm interested in how the person feels about themselves and how the trauma has affected them. And so the brain hemispheres can support a whole mind.
Right.
Uh, and if you just look at the back of the brain, it's a visual area or a auditory area, and it's not really a mind. And if someone has a stroke or a head injury in the back of their head, they can still be conscious, and but they might be blinded or deaf from their injury. Uh,
Right.
but they're still a person, and they can be aware and say, well, I need a hearing aid or something, or uh, 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 but so I think that the most important brain area, we always talk in neurophysiology about brain areas, the most important but the least acknowledged area of the brain is the brain hemisphere.
Hmm.
And and one of them is very confident and feels good. And let's try with an envelope. Do you have like an envelope or a credit card or an iPhone or something? Uh, there's
Yeah.
something that you can block your vision with.
Hmm.
So we haven't rehearsed this, and okay. So I want you to do this. I want you to you have to the way the eye is constructed, it actually is divided vertically, just by it's just a known fact,
Yeah.
and using that to that known neurologic fact to stimulate one of the brains, and so half of the retina goes to the opposite brain and half goes straight back. So if you look at the whole eye, you stimulate both sides and it doesn't do anything. So
Right.
you have to look out, you cover one eye and then move it over so you're looking out half of one eye. There you
Okay.
go. Perfect. Okay. And people at home can try this if they want. It's very simple to do. And now I want you to think of something upsetting, and and um, and I want you to see how much anxiety or whatever you feel as you think about that, from 0 to 10, so we can measure it. And you don't have to tell us what you're doing, but if you want to, you can. And so it usually occurs pretty quickly. So do you have a sense of what you're feeling? It might be nothing, or might be uh, anxiety. Do you have some measure of what you're feeling as you think about something
I,
upsetting?
I don't feel really much of anything right now at the moment.
Okay. Now let's try the other side.
Okay.
So move it over again. So you want to be careful not to look out the whole eye. A little more. There you go. Okay, good. And I want you to think about the same thing. And is it the same or any different?
No, I feel more emotion when I look out this side.
And what sort of emotion?
I feel a sense of I guess a little bit of anxiety because I feel a little pressure towards my chest. I feel a little
Uh-huh.
heavy in my heart kind of feeling.
Right,
Uh,
right. Yeah, and a lot of patients will say to me, look at the other side and they'll say, "My chest pain went away. I didn't know they're having chest pain." From, how would you measure your anxiety on the right side?
I would say at that point it was at probably a level 4, where it was at no level on the other
Yeah.
side.
So, but that's uh, uh, a big difference. In other words, to go from 0 to 4, it's a 4 point difference on a 10 point scale.
Mhm.
And would you say it was a significant difference?
Definitely.
Okay.
Definitely.
And now, if I, before we did this, if I told you you're going to hold up something in front of your eyes and you're going to feel very differently about it, or you're going to feel your trauma on one side, you'd think I were crazy.
Yeah,
Okay.
believe you.
And uh, and I didn't pay you to do that. They'd say this now,
Right.
and so there are uh, uh, some patients who come in and they don't respond, and it's possible that you wouldn't have responded, but that doesn't mean the theory's wrong. But in my practice, about 85% of people have a substantial response.
Mhm.
And those who don't, they often do later on after we do some work. They may be more repressed initially.
Right.
And um, and so when somebody looks at me out their more troubled side, I often look critical, like their mother was, or their father, or whatever. And out the other side, I look more of a empathic therapist and supportive, so it's a whole world view, and that's why I think of it as my first book was called Of Two Minds,
Mhm.
and um, uh, but it's just a strange concept, that we're kind of walking around with two minds, but
Yeah.
you're the same person, but you feel differently, and it isn't just that your anxiety is higher; it's that your perception of things will be somewhat different, and it's probably related. If you talk with yourself, you'll discover that the side that feels more anxiety is more in its trauma, and it's seeing the world through a trauma. And so the idea of what I call dual brain psychotherapy is to talk to these two people.
Mhm.
And I have glasses that we're making, and they're to simulate one brain hemisphere. And so
Yeah.
you can wear them for as long as you like, and
Mhm.
and then you just flip them over and you can simulate the other side. And
That's
and I use these in a therapy session to talk with one side or the other, but you can also use junk mail and accomplish the same thing. Uh,
wow.
and and so with your example of you felt fine in the morning, but by 2 o'clock you're feeling sort of anxious, and you've got a meeting coming up, and you've got to function well at the meeting.
Yeah.
Then I would say, uh, so in your situation, you'd want to look out the left side of your left eye. So
Hmm.
you're going to stimulate your right brain,
Right.
and so right brain is your healthier side. And
Hmm.
everybody thinks the left brain is positive. Well, it varies in people. And there are differences between the hemispheres with emotion and so forth. But this is different. This is we're eliciting a whole mind. And the troubled mind can be in the right brain or the left brain. And,
Right.
uh, and you have to test the person to see where it is. But what you can do is you can look out your right lateral visual field, and you'll notice that you do it just for 30 seconds until you feel like, no, I can handle this. No,
Hmm.
I can go to that meeting, and I can do it. And then you put it down and you go to the meeting.
Hmm.
And people can try that at home. And if they're struggling with hunger cravings or uh, again, they can get the junk mail and look out one side, and your cravings will go down. And we're doing a study with fentanyl addicts, and we're getting really remarkable results. We're using a more powerful intervention than the envelope, but the envelope is strong, and
Yeah.
the sunglasses are a strong intervention. And so right now we have a $2.5 million grant from NIH and the National Institute for Drug Abuse to treat
Mhm.
fentanyl addiction. And we have an FDA breakthrough designation. So the FDA was encouraged by our earlier results, and they're trying to accelerate the approval. And we're going to finish the study in November, but we anticipate that we're going to get good results because a lot of the addicts are doing very well, even though half of them are getting a sham treatment. So
Mhm.
it's a placebo-controlled study.
Right. Wow, that's amazing. That's amazing. Now, I know that when it comes to food addiction, a lot of people struggle with food addiction. And I think it's half the population will face a mental health struggle. Like, how big of a slice is that pie in that disorder when it comes to eating? And why is it growing so frequently? Because you see a lot of people struggling, and we hear more and more about obesity in our country, and people are struggling with eating disorders.
Right. I think that we've sort of grown out of touch with ourselves. And I think the world is more stressful than it was. Uh,
Yeah.
and so I sort of grew up in the 50s and 60s, and uh, and the world was sort of safer. It was a post-World War II society, and it was easier to advance, and I think relationships were easier, and I think the world was a little simpler. Today, it's more challenging, and even if you have a lot of advantages and you go to a good school, you find out that at the end of the day, it's still hard to make attraction,
Yeah.
and so I think all of that leads to uh, uh, anxiety and trauma, and then also um, everybody suffers trauma. You know,
Yes.
trauma is like the ocean. It's like a fish in the ocean. You know, it's kind of sometimes it's very severe, but I think of trauma as whatever hurts us and
Hmm.
and and impairs us. And so by trauma, I don't mean a war or molestation or beatings, although they occur and they occur too frequently, but uh, and they're severe and they have terrible consequences. But they're also more subtle traumas, like having a successful family and wondering how you're going to keep up with them, and that can be a trauma.
Yeah.
Often it's a trauma, but it's not recognized as a trauma.
Right.
Uh,
That's so
uh,
true. Now, is a eating disorder just ever about food, or is it always the symptom of something deeper, like a trauma or perfectionism control?
yeah, I think it's always about trauma, actually. That food is pleasurable,
Yeah.
and pleasures offset pain.
Hmm.
They don't do it perfectly, so the eating doesn't work, or the opiates don't work
Right.
ultimately. Um, uh, and so, in what I'm doing, I'm not trying to just stimulate the healthy side. I want to also talk to the troubled side and help the troubled side. And
Right.
uh, and so eating doesn't do that. Eating actually makes the troubled side worse, just like opioids or alcohol. Uh,
Right.
and So in fact, a person feels really angry with themselves if they're overeating,
Right.
or if they're drinking alcohol. It's really the same mechanism, and so that becomes a new trauma. So eating becomes a trauma, and the inability to control eating becomes a trauma, but it comes from another trauma,
Mhm.
and it's this idea that you have these rolling traumas that snowball, and
Wow.
and
Yeah, it's pretty amazing. Now, can you walk us through what happens in the brain when the brain's reward circuits when it restrictions or binging kicks in, and why does it feel like relief until it doesn't?
Uh, I don't think we know this in that kind of detail. We do know that there is a pleasure center called the nucleus accumbens, and by the way, there's one on each side of the brain, and there's a lot of dopamine in the nucleus accumbens,
Okay.
and uh, and and there are certain pleasure areas where if you took a mouse and you put an electrode in that area, it would and you connect it to an electrical stimulus, the mouse will press a lever until it dies. It's
Mm.
trying to stimulate that pleasure center. So pleasure is a very powerful um, uh, reinforcer, and we seek it. We're built that way, and especially if I think if we're not suffering a lot of pain, we're not as motivated to keep pressing the button,
Right.
and we have an electrode in our head. I think we can tolerate some pain, but if it's a severe pain that we don't understand and we feel hopeless about, um, then we look for solutions. And who looks for the solution? Well, the troubled mind does, and that's childlike. And
Yeah.
so, opening can of beer or eating a lot of potato chips is, it's pleasurable, it gives a quick relief, but then it leads to feelings of anger and disgust and upset, and so then you have to eat more or take more beer or opioids, but they're all things that are trying to create pleasure, probably stimulating the nucleus accumbens. And by the way, we did a study at Harvard at McLean where we did MRIs of people, and we looked at who had a positive left hemisphere and a positive right hemisphere. And what we found was that the nucleus accumbens was larger in the positive hemisphere and
Oh, really?
smaller in the negative hemisphere. And that the amygdala, which is the fear center, was smaller in the positive hemisphere and larger in the negative hemisphere.
Wow.
And and but a lot of this is I rather just talk to the person, say how do you feel, right? Rather than, because we can't do much about the neurocircuits and the drugs that we have are not very effective, or and the drugs that stimulate dopamine or the opioids and the stimulants, and they can give a short-term pleasure, but they're not adequate treatments for trauma and pain.
Right. Right. Now, could the immature trauma-bound hemisphere be
Yep.
driving the compulsive eating patterns?
I didn't understand.
Oh, could the immature trauma-bound hemisphere be driving compulsive, the driving force that makes you want to eat more, and while the healthier side watches in the horror? Like, how do we flip the switch?
Well, I think that's exactly right. Yeah, I think that's what I'm saying, and and I think there is a way to flip the switch, and it's expensive. Okay, and if do you ever get an electric bill?
Yeah.
Now you can use it. So so uh, so what you want to do is take your electric bill, and instead of paying it, you hold it up in front of your face, and you look
Right.
out half of one eye, not the whole eye.
Right.
Okay.
Right.
And so try when people who are having this issue, and whether it's beer or food or opioids, do this and find the side that your cravings are less on,
Right.
and you'll find that no, I really don't need to eat that.
Hmm.
No, I'm really not that hungry. And so with a piece of junk mail, you can have a breakthrough.
Right.
Seriously, but you have to take it seriously and do it properly.
Right.
And again, I think it would be helpful to read more about it um, but really a piece of junk mail could really help a lot of people if they knew how to use it. And I'd encourage people to also look out the other side and talk to that part of you, and see um, uh, what the danger is.
Right.
It's a question I would ask patients who are feeling anxious. I'll say, "What's the danger?" And anxiety is a normal feeling.
Hmm.
And if the gangsters are after you, or drug dealers chasing you, uh, uh, it's normal to feel anxiety. And depression is similar, but depression is when they get you and you're
Yeah.
trapped and you're in a cage, and people down at uh, El Salvador in the prison, or in alligator Alcatraz. So if you don't feel depressed there, you're not normal.
Right.
And so these people must really be suffering, and it's really sad, that we're torturing people like that. And
Right.
and uh, um, but um, so when you're in a situation that you perceive that is hopeless, depression is a normal response. If you've got terminal cancer and you feel depressed, that's
Mm.
normal. Uh,
Yes.
where the psychological depression is when the little person in you, the little boy or the little girl, uh, knows that he's hopeless when
Yeah.
he's really not. Then
Right.
it's a psychological problem. Or somebody attempts suicide because they feel that hopeless when they're really not. And it's a misperception. And so that's why you have to learn how to talk to that little person inside who's carrying the trauma.
Right.
And that's where depression comes from. It comes from a misunderstanding that lowers self-esteem and leads to a feeling that you're in a hopeless condition. And, and
So when you do the envelope or any or the glasses, how
mm,
long should you stay like that? Is there a certain breathing technique or should you clear your mind? Like when you covered your eye and you covered the quarter of your other
yeah.
eye, what would be the next step? Like how long would you keep it there? Would you change your breathing patterns? Would you clear your mind?
Um, I think this works in and of itself, but it's compatible with anything else you want to do. So if you want to take Prozac with it, go ahead. And you can combine it with there's a light treatment that I use to stimulate one brain hemisphere, and you can use that with the glasses. And
Okay.
so I'll give you a demonstration. So let me put this on like this. These are my sunglasses again. And so this is it's called photo photobiomodulation, and this is a near infrared light. It's the same light that turns on your television, but it's much more powerful. And the light goes through the skull into the brain. So these and the light are both stimulating my left brain,
Mm,
and so you can add them, or you can just use the light, or you can just use the glasses. So if you want to add meditation to that, that's great. And if you're good at meditating, that's wonderful. And my experience is more with talking with the trauma part, and so these are tools to help that discussion and help the cooperation between the two minds.
Yes, I see. Do you have a story that you can tell about a positive comeback that a patient who had used this technique and had a positive experience from it?
I do this every day, and and um, when the patient comes in, he doesn't realize, he or she, that their problem, uh, and it might be. Last week, I saw someone who had a long history of psychiatric treatment, number of hospitalizations and diagnoses, and and uh, and I wanted to throw out the diagnoses. I don't subscribe to them. I think he's had a lot of trauma, and a lot of his trauma are the diagnoses
Hmm.
and the feeling that he's a mental patient. And he's
Right.
a very bright, good person, and so we used the sunglasses in the office and got in touch with uh, uh, something that he was completely unaware of and hadn't. He's been had different therapies for 12 years. Uh, he never discussed, never realized that what that negative side of him was really upset about was all the fighting that went on in the family and
Right.
the yelling and the screaming so it wasn't that he was beaten or tortured or sexually abused, um, uh, but just that the family was dysfunctional in sort of the way
Yeah.
so many families are, and and I think that's the cause that's led to this 12-year journey through mental hospitals and psychiatric diagnoses and harmful medications that don't help, and they're very toxic, and um, so uh, how he's going to do, we'll have to see. But most patients who come in, if they stay with it, there are people who don't want to get in touch with their trauma and leave, or or don't feel comfortable with me, or whatever. And but people who stay get better, and it may take some time, but there are people who get better in 6 months or a year, which before I was doing this was unheard of. And
Yeah.
now I also have some people who've been with me for years, but they're people who for financial reasons come once a month, or
Mm.
and so we don't really get the opportunity to kind of really dig in
Right.
and persevere with it. But I think when I can do that, uh, in my quick judgment, I'm not doing a study. I
Yeah.
think most people get quite well and achieve a healthy state. I
I like.
have a lot of people who were abusing opioids at one time, and it just isn't on the radar anymore.
Yeah.
They're coming, just follow up. I have some people who can't get off Suboxone, so I see them for Suboxone, but
Yeah.
we also do therapy.
Wow. That's amazing. Now, can you tell us a little about your book and what it entails and where people can
Yeah,
find your book?
yeah. So the book is intended to be reader friendly. I think it's an easy read or a fun read, and
Hmm.
it has therapy sessions that are based on actual therapy sessions, but it's narrative fiction. So they're fictional depictions of actual therapy sessions about real people who gave me permission to write about the therapy sessions. All the names are changed, and so there's no identifying information. And there are about 5 of these throughout the book. And the book also talks about the theory and the research, but not in a heavy way. It's designed to be interesting, and it's a story, and how I came to discover this, and how I use it,
Yeah,
and so I think it's intended to be fun,
right.
uh, and my first book was called Of Two Minds: The Revolutionary Science of Dual Brain Psychology, and I think that was a nice read too, but I think the title was off-putting, so that's where I put the lipstick on this. And these are an earlier version of the sunglasses that may not make sense on the cover, and I have a new cover where we're going to take them off,
I
and
love it.
um, so
I think it,
so the book really it's a lot of uh, 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 stories. Um, Susan looks professional and speaks with obvious intelligence. She is 35 and married with an 8-year-old daughter. From her appearance, she might be an academic, but she is not. And it says, so I'm reading, doing a reading here, and then and it goes into her trauma, and she's done very well. Yeah.
wonderful. That's
Mhm.
wonderful. Now, where can people find your book?
Um, on Amazon and other booksellers. Um, it's only online, so you won't find it in a bookstore. So probably the main place to buy it would be Amazon. It's on
Oh, I,
Barnes and Noble online, and
right.
Apple online, um, but I think the easiest place is probably on Amazon. And if you just put my name in, it's like Adam Schiff with an ER, Schiffer, uh,
Mhm.
and uh, and you'll see it there. Just look for the lipstick, and it's also in an audio book for people who prefer that.
Wonderful.
Yeah.
Wonderful. Now, if you had to take today's conversation, you wanted to emphasize on a couple important factors, what are some things you'd like to emphasize to the listeners that you'd like them to remember?
Uh, Use your electric bill before you pay it, or after you pay it. Uh, uh, I think that's the most important point. And I think if you try it at home, you'll notice again. Think of something upsetting,
Mhm.
or if you're upset, look out one side and the other. Or if you're having cravings, do it. And most people will feel a significant difference, enough that they won't have to use.
Right.
So I've had opioid addicts come in and they have a craving of 8 on one side and 4 on the other, and or 3, and they're not going to use on the healthy side. So we try and show them that, and that helps them to control their use and understand themselves.
I love that. I love that. Well, this has been amazing. Thank you so much for being on the show. I really enjoyed this conversation. I hope you'll come back. There's so many topics we could touch base on that so many people suffer from. And, to be able to, do certain exercises and be able to, help your brain, change
Yep.
the way they think and to flip the switch,
Mhm.
is very powerful, is very powerful. You could do a lot of good with that if you know how to utilize it and understand it. You really help change your health because, post-traumatic stress disorder, anxiety, depression, addiction, eating disorders, these are things that so many millions of people struggle with, and they go about it the wrong way when there's things that they can go out there and utilize that are more natural, and that they can have a better outcome. So I really thank you for for sharing this and for doing all these studies, because you've been doing this for over 50 years. So you've been a psychiatrist and you've been in the field for a very long time, and you've accomplished a lot. So thank you so much
I'm
for
only 27, which is
you are.
amazing.
I thought you were only 27. You look that way. I thought you were actually 26, actually.
Thank you. Thanks for having me.
Oh,
Thank you.
you're very
Yeah.
welcome. You have a great,
And you're right. The envelope is natural.
It is. It's
Yeah.
natural,
Mhm.
and you can talk to both sides of your brain, and you can get different reactions, and come to conclusions about certain things that you may not have actually come to conclusions if you didn't do something a test like that, and most of all too, you hear people all the time complaining about food cravings, especially at nighttime. So to be able to do an exercise like that and be able to maybe control your food cravings or be able to control your emotions if the middle of the night, if you wake up feeling a certain way and you can just do an exercise like that, that's, I feel, is very beneficial.
Yeah, and also if we could get if people would give you feedback about whether it responded or didn't respond, I'd like to know.
Yeah, definitely.
Yeah,
I definitely, if people want to put a comment in the comment box, I would love that. Try it, try the exercise with the envelope and or you just use anything that can cover one part of your eye and a quarter of your other part of the eye. And,
or half the about half the you want to look at half of one eye.
yes, and talk to your brain and talk to yourself and ask that something traumatic and then something good and start to find out how your brain is responding and that could help you in many ways because you can understand your functions of your brain and how you operate, and that could actually help you, I think in lots of ways, in many ways, that could be beneficial to your overall health for sure.
Thank you.
Well, thank you. I appreciate you, and I look forward to seeing you in the future.
Same here. Thank you.